Hi guys, we're Group AA, and our presentation is on bacterial meningitis. My name is Rhett.
My name's Riley.
My name's Quincy.
I'm Monsi.
I'm
I'm
Noel.
Noel.
All right. What is meningitis? Meningitis is the inflammation of the meninges of the brain. The causes of it has multiple causes. The bacteria is group B, Streptococcus pneumoniae, which causes pneumococcal, Neisseria meningitis, which causes meningococcal, Neisseria meningitis. Oh, sorry. Haemophilus influenza, uh, E. coli, and Listeria monocytogenes. The causative agent for meningococcal meningitis is Neisseria meningitis. The morphology, it is a gram-negative bacteria. It's a parasite cocci. It's aerobic and it's encapsulated. This bacteria is not able to live alone, and it needs a human host to survive. Its causative agent is built up in the mucosal layer of the upper respiratory tract and uh, isn't doesn't cause a or without causing an illness called a carriage. Some signs and symptoms. It causes a fever, headaches, a stiff neck, nausea, and vomiting, and it transmits through person to person, direct contact with nose and throat secretions. So like kissing, coughing, sneezing, and then sharing a glass cup.
So, for the prevalence of this, cases of meningococcal meningitis in the United States has dramatically increased since 2021. And then in 2023, 438 cases were reported, which was the highest number of cases since 2013. And for the pathogenesis, Neisseria meningitis enters the body and resides in the respiratory system and can even actually enter the bloodstream. When the bacteria uses its pilus to adhere to itself onto the surface of endothelial cells. After this, it closes the gap between cells in the capillaries, which makes them weaker. And by this graph, you can kind of see the trend of the disease incidence. And for the prevention, the main thing is a vaccine, which is meningococcal vaccine, and then the preemptive is a antibiotic intake, and then get tested for immune deficiency also. And the treatment is antibiotics and medications to treat hypotension, surgery to remove dead tissue, and wound care for damaged skin on the body. And the outcome, if not treated, death can happen. And long-term consequences is you can actually become deaf, lose limbs, and have nerve, kidney, and brain damage.
Okay, so pneumococcal meningitis. Pneumococcal meningitis is a serious bacterial infection caused by Streptococcus pneumoniae. It affects infants, young children, elderly people are also at risk of infection. As well, it can be a fatal disease. Pneumococcal meningitis, the biology of the pathogen. So the causative agent is Streptococcus pneumoniae. Its morphology is gram-positive. It's also Diplococcus. It's a polysaccharide capsule and has over 100 different types. Pneumococcal meningitis transmission. It can be transmitted through respiratory droplets, close contact, such as kissing, sharing items such as cups, utensils, and cigarettes. The carriers are 40% of people carry it without showing any symptoms.
All right, so some of the signs and symptoms are fever, headache, stiff neck, confusion, sensitivity to light, nausea, and vomiting. And then the prevalence changed drastically since the development of vaccines. The annual incidence of pneumococcal meningitis in adults is estimated to be about 0.2 to 0.6 cases per 100,000 people from 2016 to 2018. And then the pathogenesis, colonization starts in the nasopharynx by pneumococcus. The bacteria then invades the host immune cells and invades the bloodstream. It then crosses the blood-brain barrier and enters the cerebrospinal fluid in the brain. And once it's in the brain, the bacteria multiplies and then triggers a strong inflammation response. So treatments and preventions, there are vaccines, the pneumococcal conjugate vaccine, PCV. There are 3 types of that vaccine, PCV13, PCV15, PCV20, which all use polysaccharides from 13, 20, and 15 stereotypes. It's recommended for people with high risk and children under 5. And then there is the pneumococcal polysaccharide vaccine, which is the PPSV23. There's only one type of that vaccine. It uses polysaccharides from 23 stereotypes and is recommended for high-risk children ages 2 to 18. Other ways to prevent is good hygiene, hand washing, respiratory etiquette, and early detection.
So the outcomes for pneumococcal meningitis, the mortality is that 8% of children and 22% of adults will die even with treatment. The long-term effects include hearing loss, vision problems, memory loss, behavioral and emotional problems, and cognitive impairment. Other neurological problems include cerebral edema, hydrocephalus, cerebrovascular complications, and other health issues include pneumonia, septicemia, and septic arthritis. And another kind of meningitis is Haemophilus influenzae meningitis type B. The biology is that the causative agent is Haemophilus influenzae, which is a gram-negative bacteria. It is non-motile, and it is shaped like short rods. And it was originally believed to be the causative agent of influenza, and it's often the most severe. The transmission, it is transmitted through respiratory droplets, through coughing, sneezing, and close contact. Some signs and symptoms include fevers, headaches, stiff neck, nausea and vomiting, photophobia, and confusion.
The prevalence is mainly in the United States, and the incidence of the Haemophilus influenza meningitis happens in children under 5 years old and is estimated to be 47 per 100,000 people. This influenza A is uncommon cause of meningitis. It's very uncommon in adults. The pathogenesis is typically resides in the nasopharynx of humans as part of the normal flora, and the bacteria can invade the bloodstream. And once it's in the bloodstream, it can cross the blood-brain barrier and infect the meninges. Prevention and treatment. The HIV vaccine is the most effective way to prevent this influenza meningitis. Good hygiene, such as covering your mouth when coughing or sneezing, reduces the spread of respiratory droplets, and also washing hands. The immediate treatment needs to happen with antibiotics such as cefuroxime or cefotaxime. And without treatment, this influenza has a high mortality rate of 20 to 30%. And the immediate treatment mortality decreases to 3 to 6%. And then for a Christian worldview, we chose Mark 10:45, and it says that God did not send his son on earth for us humans to serve him, but for Jesus to serve others. And as Christians, we are called to be like Jesus and to serve those who are in need, being able to provide the resources, cures, and treatment to those who need it as our role as healthcare professionals.
And here are references.